Thank you, Dr. Devmala, Dr. Mudal Sahani, and Dr. Anshu, and all those part of the Hindi session. Good morning, good afternoon, and good evening. Welcome to 1609th day of continuous and uninterrupted session of IFPH. Let us start today's program with a silent prayer for 1 minute. Thank you and welcome back. Today we have with us Dr. Sumana Kumari Panda, MD Homeopathy, retired District Medical Officer, Homeopathy, Cuttack Circle, Cuttack Health and Family Welfare Department, Government of Odisha. And today's topic is Homeopathy in pediatric respiratory infections, scope and limitations. We all know the scope and limitation as described as Stuart clause where the law of similia is not applicable or not. So on behalf of IFPH, I welcome Dr. Sumana Kumari Panda. You can have the platform for the next 45 minutes. So to you. Please proceed.
Thank you, Dr. Sen. Manoj, and at the outset, I'm very much grateful to all the organizers of IFPH, specifically my teacher, Dr. M.K. Sahni sir, and namaste to everyone. Sabko namaste. So today my topic is on a very common topic, pediatric respiratory infections, and every day we are getting such infections in our clinics, and everyone is having. But today I will discuss the keynote symptoms, the keynote prescription in a busy schedule when we are going through in our OPD, then how to proceed. Of course, all the constitutional remedy is the base for is the basis for cure of the chronic cases who are susceptible to the children. I have taken today's topic as a pediatric group, and they are very much susceptible to cold due to environmental conditions, due to pollution, and the AQI index is rising everywhere every day. So this is the high time to think over this. And the homeopathic medicines are too good in this aspect. So today I will discuss specifically the keynote prescriptions. If any other session will permit me, really I had two sessions in last 22nd and today 26th, and 22nd due to some technical problem we couldn't continue that session. Today I will go for the keynote prescription, how to go in acute cases. And chronic cases, we will discuss later on some constitutional remedy, but will be the personality study in that aspect. But today, I will focus specifically on the keynotes prescription. So I'm sharing my screen now. So homeopathy in common pediatric respiratory infections. Next, is it visible to you all?
No. Not visible.
Is it visible?
Yes.
Okay. So homeopathy in common pediatric respiratory infections. So in 2016 in lower middle income countries, there was a study that top 10 causes of death, if we will analyze, then we will find that nowadays also this is true. The ISD, ischemic heart disease, is in number 1, and the lower respiratory infections in number 3. Chronic obstructive pulmonary disease, COPD, is number 4, tuberculosis in number 5. So how important, what is these conditions, and these are the things we have to think upon this. It is the high time to think upon all these things. So and homeopathy, we are having a widespread scope. Of course, some limitations are there. Definitely, I will say I have faced those limitations in my clinics. So that's why we have to think over all these things. In India, if we will think that a 2007 report Lancet has given that the market is growing at 25% a year, the homeopathic market, and mostly 100 million people were depending solely on homeopathy. So that was a report published in Lancet November 17, 2007. So coming to the upper respiratory tract infections, we find usually rhinitis, sinusitis, pharyngitis, laryngitis, tonsillitis, bronchitis, bronchiolitis, and pneumonia. And all virus infections also we have due to rhinovirus, coronavirus. Already we have seen the effect of coronavirus, COVID-19, how virulent that was. And the para-influenza virus, respiratory syncytial virus, herpes virus, adenovirus, and Bucca virus, Coxsackie virus. So and lower respiratory tract infections we find usually influenza virus, para-influenza virus, respiratory syncytial virus, adenovirus, Bucca virus, and metapneumovirus. Mostly children are the pediatric group are the more susceptible in this aspect. So major cause of mortality and morbidity worldwide, if we will see in infants and young children, are the respiratory diseases. They suffer either due to acute infections or due to chronic non-communicable diseases, and directly the environmental factors play a vital role in this aspect. The tobacco smoking indirectly, if the in family, if anyone is a chain smoker or like that, the parents, indirectly the baby suffers. And due to poor nutrition, the immunity reduces and the baby suffers. And due to indoor air pollution also, the baby suffers. So these are the studies I will go first today. So many more studies are there in this aspect. I will say only one study. This was in Western Maharashtra. This study was conducted, which is published in October 2021 in PubMed. And they have taken a survey comprising 3,671 under 5 children. And here we find that the ARI, acute respiratory infections, comprising 50.4%. And in rural areas, that was 54.2%. And in urban areas, 46.7%. So the rate is quite high in this aspect. And besides that study also, we find it is very serious that the neonates are the more susceptible one, and the lower respiratory tract infection also in under 5 children becoming very worse in developing countries, having a higher case fatality rate. And some Black, Morris and Bryce 2003 studies say that 10.8 million children die each year due to lower respiratory tract infections. And in 2000, we find the 1.9 million of them died because of acute respiratory infections. 70% of them are from Africa and Southeast Asia. The WHO estimates that 2 million children under 5 die of pneumonia each year. So pneumonia is really very, very virulent in case of children. And when the respiration and the severe pneumonia, when the respiration rate is either 60 per minute or more than 60 per minute, that becomes also a limitation for our science. In those cases, in severe pneumonic cases, it is very difficult to survival of the child. And with homeopathy, I have found some limitations in those cases. So mortality in India, ARIs account for 14.3% of infant deaths and 15.9% of deaths in children under 1 to 5 years. In morbidity, we find ARIs are the major cause of childhood illness in India. Children from poor households, rural areas, and using unclean cooking fuels are more likely to have ARIs. The children of the HIV parents who are not immunized against the measles, rubella, like that also they are suffering a lot. Air pollution contributes much more for the cause. And when we go to the Respiratory symptoms NCBI data, we find 39% in infants in low socioeconomic group are suffering, 24% in infants in middle group, and 14% infants in a high socioeconomic group are suffering. Usually we find these conditions in respiratory dominating conditions, upper respiratory infection, cross COPD, lower respiratory infections, tuberculosis, lung cancer. Asthma is the commonest non-communicable disease in children, and pediatric TB constitutes up to 20% of the TB caseload in high incidence countries. So, and pneumonia, which is predominantly childhood mortality, we can prevent through our constitutional drugs. We can prevent very easily the condition, and taking the mask, use of mask with the hygiene, proper hygiene, avoiding the smoke inside the room, the environment, we keeping the pollution free, we can avoid also pneumonia. So National Air Quality Index we find in January only. There was a Times of India publication was there. This table highlights the cities are currently experiencing the best and cleanest air quality, where we find the lowest one in Tamil Nadu, Tirunelveli. Okay, so AQI was 30. If it is less than 50, it's too good. So, and the higher we find in Uttar Pradesh, Varanasi, Chhattisgarh. So, but the worst AQI, air quality index, we find in 2025 January, the Delhi has the 357 air quality index. The Delhi has 357, where the prominent pollutants really PM 2.5, they can enter into the mucous membrane and they cause an antigen antibody reaction inside that. And we find highest 357, Ghaziabad 332. Even the Meghalaya also we find 303 due to tourists, much more tourists we can say. And Chandigarh 302, this is the PM prominent pollutants 2.5 being finer, penetrates deeper into the lungs and bloodstream, posing higher health risk, while PM10 is larger and stays in the upper respiratory tract. Okay. So this is the Odisha, I should not say, really this I have presented somewhere. Acute respiratory infections, our topic today. So how to find out a similimum? We have to observe a very keen observation. Short case history, we have to observe the physical state and the mental state also. How, whether there is restlessness with the baby or anxiety with the baby or the fear with the baby. And in physical state, we have to find out about the thirst, about the appetite, about the stool habit, urine habit, and why the cause, what is the cause elements from, it's very important in case of acute respiratory infections. And we have to examine the patient, whether where is the pain, whether the baby is having any rhonchi in the chest findings or not, lungs findings or not. So we have to proceed accordingly. Characteristic peculiar might be from causation, might be from location, modality, sensation, modality, concomitant. And we have to find out the tongue salivation is also very, very important in these cases, acute cases. So if we will proceed by location, really everyone is aware. I will not go through the common drugs. This according to location, we find in left lungs, upper lobe, we find sulfur tuberculinum, pix liquida, phosphorus, antimsulf, solanum nigra, theridion, like that. And in, I'm talking about the lower respiratory tract. Next, I will proceed to upper. So, left lower, we find natrum sulf, calcarea phos. Asclepios tuberosa is also a very good drug for pleurisy. So, among them, some rare remedies I will discuss today. because common one everyone is using, so no need to discuss so much, because within the stipulated time we can proceed in detail. So Peaks liquida is a very good drug for bronchitis. Cough is there with mucopurulent sputa, but the characteristic peculiar symptom we find that the pain in left chest. We find the pain in below the third cartilage in left chest. We find stitching pain is there, so very acute pain we find in case of Peaks liquida. With this sputum is very offensive, and this is associated with skin itching of the skin. Acute itching of the skin might be there, skin complaints, but the very peculiar symptom we find that is the pain in the left chest below third costal cartilage, a very acute type of pain. So if we are finding that symptom with bronchitis and associated with the skin complaints, we can think of Peaks liquida. Then next is antim sulphoratum. This is also a not frequently prescribed drug. Antim tat we are using. Antim crude also, sometimes we go antim tat in lower respiratory tract infection with the rattle-like sounds, or in damp weather we are proceeding. But antim sulphoratum is not commonly prescribed. But this is also a very good drug for chronic associated with pain in left upper lobe affection with cough. But here we find very acute atrophic cica, that is the nasal condition is very acute. Chronic nasal catarrh we may find the mucus from the nose is too much associated with anosmia. But just like ammon car, we find a symptom in antim sulphoratum, that is the epistaxis aggravation in morning. While brushing the teeth, we find just like ammon car, we find this symptom in antim sulphoratum, and here we find the rheumatic factors, that is the soreness all over the body and associated with acne in antim sulphoratum. Solanum nigra is a very good drug for affecting the left upper lobe, but the very peculiar symptom we find, that is the profuse nasal discharge, mucus discharge from right nostril. So profuse nasal discharge from the right nostril we find here. Left is stuffed up. Of course, another drug we have for nasal condition, coryza conditions, Synapis nigra. Synapis nigra is also a similar drug, but there we find a scanty nasal discharge and the nostrils alternately block, just like Noxvomica pulsatilla. And here in Solan Synapis nigra, we find the burning symptoms and the stuffy nose, specifically left nostril. Stuffy nose, left nostril with burning, and we find there in Synapis nigra, we find also cough is there, which is relieved by lying down. That is not a drug for lower respiratory tract. Solanum nigra is a drug for lower respiratory tract. In Synapis, we find the coryza condition is very acute with a nose block, snuffles. Nose block left is much more affected, and along with a very peculiar symptom we find in Synapis, that is sweat on upper lip and forehead. Sweat on upper lip and forehead associated with Synapis nigra. That is a very good drug, and I have used Synapis nigra many a times for left-sided nose block, alternate sides also associated with sweat on upper lip and forehead. We find Sinapis nigra is a very, very good drug. And Solanum nigra also I have found fluent, copious, secret discharge from right nostril. So that is a very good condition for that. And coming to the left lower lobe, we find natrum sulf and calcarea phos. Already we know that those are the chronic drugs, constitutional remedies, and we have to proceed accordingly. Another drug we may find a very good drug for pleurisy, affecting the base of left lungs, severe pain, tenderness in base of lower lobe, left lower lungs, that is Asclepias tuberosa. Asclepias tuberosa, a rare drug but acts very well. And that condition is associated with a catarrhal dysentery with rheumatic pain all over the body. So that is also a very, very good drug for the base of the left lungs affection. Then right lungs, upper lobe we find arsenic calcarea carb, middle lobe chelidonium, antimtat and iodum, lower lobe calicarb, lycopodium and morxol. We have very good drugs. And those all these things are the chronic constitutional remedies. We have to depend upon the generals, physical generals and mental generals for prescription of these drugs. So already we had discussed all these things. So this is a picture where we find very acute cough. Coming to acute respiratory infections, acute catarrhal condition, already we had discussed the allium cepa, arsenic, ars iode S. Arsenic, allium cepa and ars iode, we find very acrid excoriating discharges burning inside the nose. That is very acute. And burning inside the nose also we find in case of sanguinaria nitricum. Sanguinaria nitricum also we find that nose block is there, the right nostril is blocked up, both sides I have used, right and left both, but burning pain is very acute in case of arsenic iode, allium cepa, sanguinaria nitricum. Allium cepa we know associated with acrid nasal discharge with a bland lacrimation. In ars iode, frequent sneezing, fluent coryza, aggravation in warm room with great restlessness. All these things we find in case of arsenic iode, and sanguinaria nitricum we find that is associated with redness is there, the sanguinaria symptoms, and a headache is associated with that, and acute pharyngitis like symptoms we find in case of sanguinaria nitricum associated with acute catarrhal condition. The itching inside the pharynx, just like Vaidya and sanguinaria nitricum, we find very acute. I am talking about only the keynote prescription. But in chronic pharyngitis, we have to go for constitutional remedy basing upon the physical and mental generals. My topic is only on keynote prescriptions. So here we find Dulcamara, in damp weather, aggravation from change of weather. Specifically, we find this in March, April, when the change of weather takes place. Morning in March, April, we find much more heat in daytime and afternoon raining, heavily raining. So in Odisha that happens. So in that condition, we can think of sudden change of weather. We can think of Dulcamara also. So other drugs like naphthalene is also a good drug in acute catarrhal conditions. There we find just like phosphorus, pain in between the shoulders, and osmium is also a good drug in acute catarrhal condition. There is stringy expectoration. acute laryngitis, dry cough, and just like hydrastis and calibicromium, we find stringy expectoration. And Synapis sabadilla is also a very good drug for acute catarrhal conditions, frequent sneezing. Too much sneezing associated with pain in throat with tonsillitis, and pain shifts from left to right, just like lachesis, just like mergbinioid, like that. Here also in sabadilla also the left-sided affection is more we find there. Sticta pulmonaria is also a very good drug in acute catarrhal conditions. That is the dryness of the nose, severe dryness. If anyone personally have used Sticta and experienced that, you can feel the dryness of the nose is much more associated with the pain at the root of the nose, associated with headache, cough, dry cough, aggravation at night. Even Sticta is a very good drug associated with the rheumatic pain, pain in the nape of neck and the right shoulder deltoid, we find associated with the cough. And in Sticta also we find a very good drug for influenza, for cough after measles, just like Pulsatilla, Drosera, Carbovis, like that, Rostox. We find Sticta is also a very, very good drug in those conditions. Chronic catarrhal conditions, if we are thinking, then these are the drugs, but here we find the constitutional remedy. We have to go for detailed case history. Without detailed case history, it is very difficult to think chronic catarrhal conditions. Enlarged tonsils, the sore throat, inflamed, enlarged tonsils, we find the drugs like Agraphis nutans is a very good drug for acute tonsillitis, where we find that the throat deafness, the hearing impairment we find in case of the pain from throat shifts to Eustachian tube, just like Rostox, Pulsatilla, Morgdolcis, Agraphis nutans, there we find. And Agraphis is also a very good drug for adenoids, enlarged adenoids, just like our sanguinaria nitricum, just like Sticta also. We find just like Sabadilla also, we find Agraphis is a very, very good drug, Agraphis nutans. Elanthus glandulosa is too good for acute enlarged tonsils associated with great weakness, just like Phytolacca also we find great weakness. Phytolacca is also a very good drug in acute tonsillitis conditions. I have written, and these acute tonsillitis conditions, pain is aggravated by warm drinks. We find in case of lachesis and Phytolacca. Usually, we find pain aggravation aggravated by cold water and relieved by warm water. But when the warm water aggravates, then we can think of conditions like our lachesis and Phytolacca. These are the too good in those conditions. Empty swallowing also aggravates in case of lachesis, and Phytolacca pain referred to years, just like Agraphis I told you, the deafness is a temporary deafness in these conditions. This is not chronic deafness, temporary deafness. And chronic tonsillitis, we have very good drugs like Veritacar, Verita-iode, Bromium, Calcarea carb, Calcarea iode, Conium, Oxal, Sorinum, Phosphorus, Sepia, Silesia, Sulfur, Tuberculinum, and Streptococcine. In some cases, I have found that when the blood ASO titer when goes up to 600, 500, 600, 800, 1000, like that, in those cases, I have usually in my practice, I have applied streptococcine 30 twice daily for 1 week and give stop that for 2 weeks, again another, again repeat it for 1 week. Like that I have used along with the constitutional remedy. Whatever the constitutional remedy comes, I go for that in fractional doses, but streptococcinum I have used streptococcinum in 30, 200 like that. For when I am giving 200, then I went for 5 days twice daily, then stop it for 20 days. Again, I repeat for 5 days like that. And I have seen that streptococcinum has a very good result in case of increased ASO titers, in case of chronic tonsillitis, chronic enlarged hypertrophied tonsils in those conditions. Stuffy nose, immune curve is too good, associated with epistaxis and aggravation at night. Already we have seen stuffy nose. Arsenic yes, acrid discharge, acrid coryza, arsenic or iode, oron triphyllum is also a very, very good drug. In that case, we find flux and inside the crusts inside the nose, just like Surinam, Calibicromium, Lycopodium, we have there. But in case of Aurum and Calibicromium, Surinam, when the child bores the nose constantly in Aurum triphyllum, but when the crusts are removed from the nose, then it leaves a bleeding area or a raw, sore, raw location. In that place, there we can think of Calibicromium and Surinam, or Surinam. But if the child bores the nose constantly, itching inside the nose, then we can think of aurum triphyllum. Lemna minor is also a very, very good drug for snuffles nose block, specifically in damp weather. In monsoon season, we can think of lemna minor. In winter, in stuffy nose, we can think of ammon carb. In every season, we can think of. In winter, specifically, we can think of Nux vomica, a very good drug, alternate sites aggravation in Casticum also we can think of. Surinam in long run cases, chronic cases. And Sambucus is a very, very good drug for children. For children in Sambucus, nose block, the child gets up frequently, very disturbing sleep. The child gets up with dyspnea, nose block, very much suffocation in those cases. And there another peculiarity we find there, just the reverse of Punyam and China, we find the sweat aggravated when wakes up. Sweat aggravated on waking. Waking on sweat aggravates. We find there in those cases. Sambucus, definitely this helps a lot. And aggravation at night, stuffy nose aggravation at night, usual. This is a very common symptom with the children. And there we find in acute cases also, we find Amonkar, we find arsenic also, we find Sambucus, we find Nux vomica, Lycopodium, aggravation only at night with clinkers inside, crusts inside the nose. Amonkar by 3 a.m. we find, and Calicarb, all these things are chronic cases. But in very acute conditions also we find these drugs, Synapis nigra, left side stuffy nose with acrid burning but scanty discharge. So like this we can proceed. In Teucrium is also a very good drug for both side nasal polyp, and the child on with the side on which the child lies upon, that side is blocked. If in left side, the right side the child baby sleeps, the right nostril is blocked. In the left side the baby sleeps, the left is stopped up. So in this way also we can think of post nasal catheter also. Typrium is a very, very good drug like natrum car, phosphorus, like that. So, next is coming to MOMS. We find in left side Rostox, Bromium, Thuja, right Belladonna, Phytolacca, and Cyclicia, both mercury. But hard indurated MOMS, I have found the parotid adenoma like that. The MOMS retained like parotid adenoma like that, or hard indurated MOMS. In those cases, we can think of. I have found very good results with the conium, beretta bromium, and if these are not effective, then I can go for parotidinum. The nosode parotidinum doing very good effect in these cases. Hoarseness, laryngitis, we can think of argentum metallicum in singers, or overuse of voice rostrux with the political leaders, with the good speakers, orators. In those cases, we can think of, if hoarseness comes, then we can think of argentum metallicum and rostrux. But in chronic cases, if repeatedly this is happening, then after rostrux, in these cases, we can think of calculator. What I have done, gone for calculator. Hoarseness aggravation in morning, we can think of calculator, posticum. Aggravation evening, carbovase and phosphorus. Aggravation from heat, we can think of antim food, bryonia. And after exposure to cold, we can think of aconite, belladonna, hipersol, like that. So in this way, in acute cases, keynote prescription, basing upon the modalities we can think of. Long cough, already I had discussed. So in these cases, we have to go for constitutional remedy, specifically constitutional remedy. Even if in cough is very difficult in case really in every clinics, because the patient can't say particularly about the modalities. Modalities play a very vital role for the prescription of in acute cases. So whether the cough is dry or loose, first we have to think of. If it is loose, the type of color of expectoration, white or yellow or green. In winter, we are specifically we are finding many more times the greenish sputa aggravation in morning. What time it is more aggravation in morning and dry cough throughout night. So in that case, we can think of calibicromium, pulsatilla, usual. Hipersol is a very, very good drug. Tuberculinum also we can think of. In greenish sputa, we can think of kali iode if associated with sneezing like that. Calibicromium is very good drug, very difficult sputa. The aggravation, but the modalities we have to encounter, that is 2 a.m. to 4 a.m. we can go for Calibi, to 3 a.m. we can go for Camoncar, we can go for Cupramate, we can go for Calicar, like that. In Cupramate, I have seen cough associated with severe cramping pain in abdomen by night 2:30 to 3:30, severe pain in abdomen associated with very horrible cough, horrible, very suffocative cough, like that we found in case of Cupramate. In Cocos cacti, Cupramate relieved by drinking water. Just like causticum, we find in Cupramate cough relieved by drinking water. Cocos cacti, profuse mucus in morning, and the late part of night, the cough is whooping cough like cough, and too much, very long cough. We find in case of Cocos cacti, Drosera, coral rub. In Drosera also we find cough is very horrible. The child gags, vomits whatever has eaten and gags like that, and it is at night, aggravation sleep during, and measles after. If it is measles after, then that's again too good. But Drosera is frequently asthmatic cough we find there. Nowadays in winter we find hypersol, spongia. Spongia is asthmatic cough, more asthma we find in case here. And so cough is really, still then we are having very, very good drugs. Still then cough becomes a headache sometimes in case of in for me sometimes I have found the patient is unable to explain about the modalities by seeing observation. If we are observing the child is very restless and very anxiety too much, then arsenic also helps in those cases. Most of the time, we can't forget Ipecac. Ipecac is a very, very good drug for asthmatic coughs, too much suffocation with the baby. And we find suffocation. Of course, two drugs I have found too much suffocation with much more cough with vomiting like that. I have found in Ipecac, and the Lorocerasus is also a very, very good drug in those conditions. So, but Ipecac has helped me a lot. Children dyspnea, I have seen a case in Lorocerasus already I have discussed. The Sencris. Sencris is a very good drug while in children, in adolescent, in adult, in everyone. The symptoms are the restlessness of anxiety and restlessness associated with the dyspnea of arsenic is there, and the modality is aggravation, sleep during, aggravation, waking on from sleep, just like lachesis. The mind is too angry, and but associated with restlessness and anxiety. We find midway between lachesis and arsenic. We can think of Sencris is a very, very good drug, and I have seen in with Sencris the patient improved. Of course, with in a aged girl, I had given two cases. I had given Sencris in case of dyspnea, too much dyspnea, too much dyspnea. The girl was unable to speak even, too angry. The lady was, but that was. I had gone to this Sencris from modalities and from the mental state associated, and she had a very good symptom. I had from dreams of being raped. She was a girl of 27, 28 years, not child, pediatric group. Sencris. And coming to bronchial asthma, seasonal according to the modalities, we can go in aggravation in August, the damp weather, we can think of like this, Blattard or Camara, Natramsol, Drosera, Kaliiode. Kaliiode is a very, very good drug. Aggravation, the most of the Kaliiode usually chronic coryza associated with asthmatic condition, associated with rheumatic pain all over the body, aggravation at night in damp weather, pain aggravation by lying down, relieved by motion. So like this we can find in case of Kaliiode. And Drosera, a very good drug already I had discussed. Aggravation in autumn, China, Veratrum album, Ipecac. Spring, Aralia. Aralia, a very good drug in March, April, in spring season. The symptoms are the acute coryza associated with dyspnea, too much dyspnea, aggravation, lying down, aggravation by 11 p.m. The time is very, very important in case of Aralia by 11 p.m. And I have gone I have seen the good results with mother tincture, and with 6 potency also I have gone through, and I have found very good results. Ars iode summer, aggravation in summer, ars iode, cipelinum, calibicromium, natramur. Winter already we have discussed. Aconite is a very, very good drug. If the child comes with a severe asthma, with the respiration rate is 35 to 40 per minute, and in those conditions too much restless anxiety, I have seen aconite helped a lot. Aconite 30 potency I had administered with fractional doses every 10 minutes, and I have seen very good results in those cases. Grindelia is also very good in winter. Of course, I have gone with the 6 potency and mother tincture. Both the I have found very good results. According to posture, also we can think of in bronchial asthma aggravation lying down, arsenic, aralia, bromium, carbovage, cistus, ferrum, calicarb, silesia, sulfur, ambragrisia, antimatat. Ambragrisia specifically in children and old people, very nervous hysterical persons. In those cases we can think of. Relieved by lying down, Calcarea fos, Bryonia, Euphrasia, Lorocerasus, Natrum sulf, Nux vomica, Sorinum, and Synapis nigra also we can add, relieved by lying down. Relieved by lying on abdomen, Medurinum beretacar. Relieved by bending forwards, we have Calicarb, Calibicromium, arsenical, black cassis spongia. Relieved bending head backwards, we found Chamomilla, Hipporsol, Belladonna, Spongia, Veratramal. Relieved by rocking, arsenical and Calicarb. Calicarb is a fantastic drug. I have cured a case of small children like relieved by rocking. So basing upon this symptom, this was my the first case was my failure, and I learned from another one of my friend this Calicarb, and next when I administered, I got very good results. Relieved by rocking, arsenical, Calicarb, bronchial asthma. Aggravation by sitting, ferrum, paramecic, Lorocerasus, Sorinum, carbovage, sulfur. Relieved by sitting of arsenic, bromium, ferrum, and Calicarb. According to time, already we know 1 to 2 am arsenical, aggravation 2 am, arsenical Calibi, Rumex, Antimatat, Sambucus, 2 to 3 am Caliars, 2 to 4 am Calicarb, Amoncarb, and aggravation 3 am Sambucus, China, Cupromet, Calicarb, Calinitric, Calibi, Thuja, 2 to 5 am Caliars and Calicarb, even Hipporsol will be there. 2 to 5 am. 3 to 4 am Calibi and Hipporsol will be there. 4 to 5 am Natrum sulf, Stannum, Calibi, of course Hipporsol is there. Then 4 am penicillin, aggravation 5 am Caliiode and China. So pneumonia, these are the very good drugs, but I will say that when the respiration rate really exceeds 50 per minute and the child is very anxious, leave that case to be managed with the modern system of medicine allopathic system, because it becomes very panic in the small children. The life risk is there. So I have seen Lorocerasus helps sometimes in these cases. Aconite also helps, but the many of the cases I found the limitation in prescription, in specifically in case of pneumonia. But when the case acuteness is managed with the allopathic system and the child comes to us for dyspnea, for cough, then these drugs we can apply, and very well we can cure the child, or we can prevent the next episode, the recurrence we can prevent in those cases. So what I have found, this is the limitation really in acute pneumonia. What the authors say about asthma, the Evinas has focused upon ipecac and arsenical, and Sinega in low potency also. Herring focused upon the arsenical, bryonia and Nux vomica. M.L. Tyler focused upon Chamomilla, ipecac, natrum sulf, pulsatilla and Sambucus. Clark has written Bacillinum 30 and 200. And Hahnemann focused upon ipecac. Dr. Borland focused upon thuja, and next followed by sulfur. And Kent focused upon ipecac, Wester, midrinum. So this is the chronic case. In another session, we will proceed to that.
Yes.
Okay. So thank
Okay.
you. Thank you for the
Really a spectacular edition of our this IFPH session, because you are a material medical teacher. It reflects throughout the presentation. You wonderfully compiled these medicines and how to discriminate. That's the most important. Everybody can talk about symptoms and medicines, but how to discriminate, how to connect with the concomitant symptoms are the most important thing. So it's time for discussion. Those who would like to participate, please raise your hand. After listening to 45 to 50 minutes, what is your observations and opinions? I think, Madam, you can, Dr. Sundar is there. Dr. Sundar, please unmute.
Good evening, madam. Madam, what is the dose and dosage you are advising?
About the doses, really, I had discussed. Mostly in Grindelia, I have gone through mother tincture and a lower potency, and usually in acute cases, I have gone through lower potency. Specifically, 6 potency, arsenic, hipersulf, like that. Whenever I have given spongia, like that, the lower potency with the frequent repetition. Otherwise, in some cases like osimum, aralia, Grindelia, I have gone with the mother tinctures. And in small children, the dose might be 5 drops thrice daily. And in very acute cases, I have gone for the fractional doses usually. Like suppose hipersolve 30, I have added 1 drop to with the 30 ml of distilled water and give it 1 teaspoonful every half an hourly or 1 hourly, like that. So I have gone like this, specifically with the lower potencies.
Okay.
No, are you advising any food restriction or anything like that?
Yes. Food restriction definitely. With the exposures, number 1 is application use of mask. Number 1, but it is very difficult in case of children because the children will not accept that. But
Yes,
if it is possible, then I advise them to use that. And steam inhalation also. If the child is more than 7 years, 8 years, like that, he can go, but less than that, it is very difficult also. Again, and another thing I have nowadays, I am advising the parents for the very small kids that you go when they sleep. The mother should put on him with a sweater, the cap, the socks, like that, because they can't keep the cover. They can't keep the blanket. Okay, they are removing it out, and at night it becomes very cold. That's why with all winter garments you sleep them, make them sleep.
Yes, okay.
And about food habit, I am advising to avoid the cold food, like that. Cold food and cold drinks, directly freezed items, and dahi in some cases, ripe banana in some cases.
Okay. But should remember that should be also in accounts the medicine also. Not only the disease, but the medicine and the season, all these things should be connected together. Now, Dr. Sridhar sir is there. Sir, please unmute. Sridhar sir. Please unmute, sir.
Yes,
Yes, sir, please.
it's audible.
Yes, of course.
Yes, madam, it was a wonderful session, but I like to ask one question.
Yes, thank you.
That in status asthmaticus, what you are going to do with homeopathy? Status asthmaticus.
Status asthmaticus. Yes. So in case of status asthmaticus, usually I have seen very good results with aconite. Aconite number 1 in fractional dose every 10 minutes 1 teaspoonful, Aconite 200. After 1 to 2 hours, I keep them in my clinics. After 2 hours, suppose the child is not improving in those cases, then I saw the case, what is the symptoms needed. If mostly ipecac and aconite, spongia like that, grindelia, mother tincture, so you normally we can drosera in some cases. I have found a very good result in those cases. But if after 4-5 hours, 6 hours, the patient is becoming a very suffocation, Laura Cerasus even. So even if after using all these things, if the child's condition, I told you that if the respiration rate becomes more than 60 per minute like that, I refer the case for inhalation or a nebulizer like that. You use this or and the case might be managed for 2-3 days, and next I am prescribing drugs.
Yes, okay. Now,
Thank you very much, madam. Excellent. Come again for this such wonderful.
Yes. Okay, Hadir sir, please unmute, sir.
Okay, madam, your selection of this subject is very nice because all homeopaths are facing is such a respiratory problem of children in every day. In my opinion, I like to say one thing is that it is only an exacerbation of chronic miasm. So we must look into the we must look into the miasm and give the basic remedy of constitutional medicine. Then you start the acute medicine. Then it will act wonderful. I mean, suppose it is a calcarea carp child. You first administer the calcarea carp medicine and then you give the acute medicine. You said all the acute medicines I learned from you, but my experience is that without this constitutional medicine, this acute exacerbation will not stand for a long time. So next day or next 3 or 4 days after, it will again come out. But if you administer the constitutional medicine and then you administer the exacerbation medicine, acute medicine, it will act wonderfully. That is my opinion. And I have a lot of research. But don't forget, some of psychotic medicine. That is, one is Tuja, tuberculum, natrosur. These medicines are wonderfully the basic constitutional medicine I have seen. And another thing I like to say, it is that, area-wise, it is different. Coastal area,
Sir, you might have not gone just my beginning.
Yes, that's the problem.
That,
okay. Now,
that in beginning I had told that the constitutional remedy is the best, and we have to continue with that. And when in case of acute exacerbations, but today my topic was on the acute conditions.
Okay.
But I have in second session I will go through the chronic miasmatic drugs, defecting drugs, that I have, whatever I have spoken today, that is along with
Yes, it is clear. It is clear,
constitutional
madam.
remedy.
Now, Dr. Ram Pravesh, sir, please express a lot of thanks. We had wide up in time, please. Yes.
Thank you, Manoj ji, and everyone. Namaskar and congratulations, Dr. Panda, madam. Very nice presentation. Acute respiratory tract pediatric angle of treatment, symptomological angle. Symptomological angle, acute case is a very good selection of remedy. And many kinds of medicine. Very, very thanks, madam. behalf of IFPH, very, very thanks. But lekin chronic cases, influenza vaccinum 200 and influenza 200, one dose alternate 10 days. Only one dose is a very good action of pediatric respiratory tract, coryza, whooping cough. Okay, sir. Thank you, madam. Thank you, behalf of
Thank you.
IFPH.
Thank you.
Okay, it's time to wind up the session. Hope you will be back again tomorrow. Till then, goodbye and over to Shaila to continue the program in Malayalam. Thank you.